These deaths are not anomalies. However, the prospect of justice for the deaths of black men and women has been all too rare. There has been no justice for Breonna Taylor, a black woman who was shot and killed by the police while sleeping in her own bed. We hear the echo of the words of Eric Gardner. We relive the pain of the death of black Wisconsinites like Dontre Hamilton, Seville Smith, Ernest Lacey, and Tony Robinson. We listen to the call and repeat, answered by a generation of black voices who marched before in these very same streets. Millions of people around the world have gathered to memorialize George Floyd, to demand change and accountability, and to call on this country to keep its promise of justice, fairness, and equity. I've seen the hope in those who've joined this cause in peaceful protest, not only in Milwaukee and Madison, but in Wisconsin towns like Sheboygan, Tomah, and Wausau. The people of our state are supporting their neighbors and showing up with brooms and dustbins in hand to help clean up our neighborhoods. We must use this dark moment to begin to be an example for the rest of the nation. We must fix what we know is broken in our society. We must intentionally address and dismantle individual and systemic racism, discrimination, and bias. Earlier this week, I called upon the legislature to immediately pass Assembly Bill 1012 that would reform our use of foreign policies by prioritizing preserving life and minimizing the use of force, and send it to my desk for signature. Accountability for unacceptable use of force by certain law enforcement officers in our country and our state, it's a good start, but there's much more work to be done. I'm also calling for local government leaders to join us in demanding change, and I'm asking for partners to step up in every corner of this state and put in the work that needs to be done. This is a watershed moment for our nation, one that requires everybody willing to come together. We need systemic change to address the disease of racism in our state and our country. We have seen its effects in the disproportionate burden that people of color have borne in this COVID-19 pandemic. Black people make up only 6% of our state's population, yet our black friends, families, and neighbors represent 19% of the total cases and 25% of the state's deaths. Similarly, Hispanic people represent 7% of the state's population and represent 34% of the total cases and 10% of the deaths. These statistics represent real people whose lives have been affected by inequities that cause them to suffer disproportionately from chronic diseases like heart disease and asthma. These same inequities increase their risk for COVID-19 and put their health in greater danger. Wisconsin continuously ranks among the worst in the nation in disparate outcomes for marginalized populations. Black babies are 3 times more likely to die than white babies. In Wisconsin, the white infant mortality rate is 5.2 per 1,000 births, compared to a rate of 5.7 for black babies. Further, at 15.7 per 1,000 births, the mortality rate of black babies in Wisconsin is the worst in the nation. One of the most important ways we can help work to address these racial disparities in health outcomes is by accepting federal funds to expand Medicaid. Not only would we be able to provide health care coverage for tens of thousands of people, but we would reinvest in our healthcare systems and local public health systems. By expanding Medicaid in Wisconsin, we can improve access to quality, affordable health care for people across our state and help address disparate health outcomes for people of color. And at a time when our state and local governments are dealing with budget shortfalls, where Main Street is struggling, where more and more of our neighbors are underemployed or out of work entirely, and where all too many families are experiencing housing insecurity and food insecurity, expanding Medicaid makes good financial sense too. Analysis by the Wisconsin Department of Revenue shows that in federal fiscal year 2020, Wisconsin residents will pay an estimate $1.01 billion a year in federal income taxes to support Medicaid expansion in other states. Wisconsin residents experience no financial benefit or return for this spending, and they can expect to pay this amount regardless of whether the state chooses to expand Medicaid coverage. It is unconscionable to me that we are leaving these funds behind in Washington, D.C., instead of using our tax dollars to improve health outcomes for folks in Wisconsin. But we can't focus solely on health care and health outcomes. Racism itself is a public health crisis, one that impacts every facet of our lives. 1 in every 3 black kids in Wisconsin live in poverty, a rate that's 3.5 times higher than that of white kids. Black Wisconsinites are more than 11 times more likely to be incarcerated than their white counterparts. In Wisconsin, 85% of white adults aged 25 to 54 are employed, compared to only 61% of black adults in the same age group. This disparity in employment of prime-age workers is the worst in the nation. Black Wisconsinites are nearly 3 times more likely to be unemployed than white Wisconsinites, which is the worst unemployment disparity in the nation. The median annual income for white households in Wisconsin is just over $59,500, a little more than twice as much as the median income for African American households, which is $29,000. We also see the disparity in housing, where more than 70% of white families own their home, compared to just 27% of black families in Wisconsin. To say it bluntly, these statistics are sobering and they are devastating. Just like we cannot look away from police brutality and the killing of black men and women, we cannot look away from the reality that inaction, indifference, and institutional racism has harmed generations of black and brown Wisconsinites. This cannot be who we are any longer. We must act,